In this video, we shall see very quickly all these topics which are asked in this NEET PG 2022 exam. A 32-year female presented with heavy hair loss since 4 months with a history of affected with COVID-19 8 months back. So the answer for this question is, you are able to see diffuse hair loss in this female. So the answer here is phyllogen effluvium. Phyllogen effluvium. So this is the next question. A farmer having a history of trauma in the lower limb followed by which there is a development of cauliflower-like growth on the same site of trauma. On histopath, copperpenny bodies were seen, and this answer is chromoblastomycosis, which is also called as verrucous dermatitis. This is in fact a repeat question from AIIMS May 2022 exam. So patient came with some nail changes. So nail changes are present on examination. Irregular pitting is noted and subungual hyperkeratosis is observed, and pathognomonic oil drop sign is also seen, which is also called as salmon patch sign. What is the diagnosis? Yes, the diagnosis is nail psoriasis. Nail psoriasis. And here you are able to see these are bite out spots. This is basically ophthalmology question. Answer is vitamin A deficiency. In vitamin A deficiency, we can see bite out spots. So there is a 0.3 centimeter ulcerated nodule over the tip of the nose. Histopath was given in the exam, and the histopath is clearly depicting the palisading arrangement of the basal cells, stratum basal cells. So the answer here is basal cell carcinoma. And what is the possible association with this skin condition? What you are able to see over the neck, velvety texture and hyperpigmentation can be seen. This is acanthosis nigricans, which can be associated with polycystic ovarian syndrome, which can in fact be associated with metabolic syndrome. So the answer is metabolic syndrome for this question. And the next question is, genital warts are there in a patient and the genotyping was done. Genotyping of human papillomavirus will be associated with which of these strains, whereby there is a development of high risk, that is carcinomatous possibilities. High risk cancer is associated with, yes, it is HPV 16 and 18. And this is the next question. A patient undergoing treatment of patch of tuberculoid leprosy on the forehead, nose and bilateral cheeks. What is the most common nerve affected in this patient? The answer is trigeminal nerve. Okay. So this is a very short and sweet discussion of all these questions of dermatology subject, and if you wish to watch the detailed explanation along with the timestamps, I will leave the link for that video in the description in the first comment and also in the iCard above. You can check that out and you can watch all the explanation for each and every of this question whichever I have mentioned the answer in this particular video. So these are all the MCQs on which the questions were asked. If you found this video helpful, please do hit that like button and also do share this among your friends and do subscribe to YouTube channel for more of these latest updates on a daily basis. Myself, Dr. Maddineni Srinivas, signing off. Happy learning dermatology. Bye bye. Sarvam Sri Krishnarpanam. Sarve Jana Sukhino Bhavantu.